Thanks very much, Tammy. Yesterday marked World Heart Day, which shines a spotlight on heart health and heart disease, the leading cause of deaths globally. Here to help us stay heart smart is Dr. Paula Harvey, a cardiologist at Women's College Hospital. Dr. Paula, thanks for being here.
Thank you very much, Meredith.
First of all, I have to say, Women's College Hospital, one of just the most premier facilities we're so fortunate to have access to in Toronto and Ontario and beyond. So thank you for all of the incredible research and work that you do there. Let's speak specifically to heart disease. I'm sure, people have unfortunately become quite familiar with it. Let's define it and talk about some of the problems associated with it.
So when we think about heart disease, people generally would think about heart attacks. So when you have narrowing and blockages of the arteries to the heart. But there are other types of heart disease that it's important for people to know about. And heart disease really can affect anybody of any gender and across any age, although it does become more prevalent as we get older. So in addition to heart disease that's causing heart attacks, there's problems where the heart may not pump properly and we can have heart failure, where the electrical system in the heart may not work properly and then the heart starts beating in irregular rhythms, and that can cause problems including sudden death. And there can even be problems with the valves in the heart where the valves don't open properly or are leaky, and they also can lead to heart failure. So we're looking at something that can cause severe symptoms and even death.
And risk factors that contribute to heart disease, let's call those out as well.
So there's what we call traditional risk factors, and again these tend to affect anybody of any gender. So we're looking at things like cigarette smoking, diabetes, high blood pressure, known as hypertension, and high cholesterol. There's sedentary lifestyle, which we're all rather guilty of, dietary factors, poor diet, stress is a big one, and even things like poor sleep and depression. Now, they're the traditional risk factors, but there are other risk factors we're learning about, and I'm from Women's College Hospital. We've learned a lot about risk factors in women. And so if we look at women, things like changes in our hormones over our life cycle can affect our cardiovascular risk. So perimenopause and menopause. Pregnancy. People don't realise pregnancy is our first stress test. And even the contraceptive pill can increase the risk of heart problems. And then there's things in the way that we live. So we talk about things, just as an example, like caregiver burden, where you may be sandwiched between caring for a young family, parents, spouse, etc. You may know about risks of heart disease, but not look after yourself.
Well, it's so interesting because you're calling out, physical symptoms, but there's also sort of emotional and hormonal things as well.
That's
so
right.
really painting the full picture and certainly taking it away as this idea that it's some kind of man's disease. I mean, really dispelling that for sure. What are we doing to improve our health and to sort of mitigate some of those risk factors?
So this is really important. We know that at least 80% of heart problems can be prevented if we pay attention to risk factors. So number one, I would say, is be aware and have yourself educated and speak with your primary care provider. And then ask your primary care provider about, about your numbers, about your blood pressure, about your cholesterol, whether or not you're at risk of diabetes. If you're cigarette smoking, maybe now is the time to give up smoking. And there's lots of ways that we can help people now.
Knowing the numbers is really key, and we're short on time here. But again, Dr. Paula Harvey, the work that you do at Women's College Hospital, where can people find out a little bit more information?
Well, you can go to our website or to our social media feeds, and there's lots that we are doing there, both in research and in clinical programs.
Being aware, not turning your head on this. Let's take this head on and really make sure that we are heart
be proactive.
Healthy. Be proactive. Be proactive. Thank you so much for being here today. Really important reminders. BT will continue right after the break.